Welcome to the new edition of JDC Diabetes Gems video. In this edition, I will be discussing on tips in treating type 1 diabetes. Type 1 diabetes is a different form of diabetes altogether. It is probably the most difficult to treat diabetes. Type 1 diabetes is a challenging disease. However, with the newer technologies and therapies, it is easy to treat diabetes. And here I provide you with 8 tips in successfully managing type 1 diabetes, dedicated to those with type 1 diabetes and to those parents taking care of children with type 1 diabetes. The diagnosis of type 1 diabetes is a little shocking situation for the parents. The treatment of type 1 diabetes is really frustrating, but don't get disappointed. Never get disappointed. With the newer insulins and with the newer technologies, if you are meticulous in managing type 1 diabetes, it is going to be really successful. Never be frustrated. Be cheerful. Did somebody tell you that there is a cure available for type 1 diabetes? No. There is no cure for type 1 diabetes. Believe in science. Believe in medicine. For type 1 diabetes, the patients require multiple daily insulins or insulin pump for survival. Never go for unproven or magical remedies. If you go for unproven therapies, the patient may even die. So never experiment with your life. Believe in science. Did somebody tell you that the lifespan of type 1 diabetes patients are short? No, never. Type 1 diabetes patients will live normal and probably they live longer than others. But if you experiment with unproven therapies or if you go off insulin, then you may die soon. Or else the life is going to be absolutely normal and healthy like any other individual. Believe me. In type 1 diabetes, the sugars are haywire. It can go up and down anytime, and patients need to test their blood sugars with glucometer 4 or 6 or 8 times daily as per the instructions of the physician. You should test for sugars several times daily, and with those sugar values only you can adjust the dose of insulin injections. Never forget to carry the glucometer with you. How do you treat type 1 diabetes? Of course, there are different therapies available. The best is insulin pump. Even the best insulin pump may be the first in the generation of artificial pancreas. The 640G is available even in India, but they are very expensive. If you cannot afford, go for multiple daily injections, minimum 4 injections per day. You cannot treat type 1 diabetes with 1 or 2 injections per day. If you cannot go for the best, go for the next available option. Always remember, there are several medications and newer technologies, including the newer continuous glucose monitoring devices, which will help you very successfully treat type 1 diabetes. Do you argue with the doctor? Never do that. Your doctor will provide you with the best advice. And that advice can be multiple pricks for blood sugars, multiple shots for the insulin. Never argue with the doctor. Never request him, can you please avoid the injection before the lunch? My child is in the school at that time. No, never do that. It can, in the long run, impair with the lifespan of the child. Never experiment. Always go as per the physician's advices. Medications are not just sufficient for type 1 diabetes. You need healthy diet and you need exercise. Get advices on diet and exercise from the diabetes team, from the trained diabetes team, customized for the particular patient. Very, very important. Do we have any therapies under clinical trials? What is the future of the treatment of type 1 diabetes? Yes, the future appears to be very bright. We have the newer technologies, the closed loop technologies coming up very soon in the next 2 to 3 years time. Now we have the 640G. 670G will be there in the market within 2 years. And soon we are going to have a completely closed loop artificial pancreas with multiple hormones, insulin, glucagon, pramlintide, etc. etc. All our type 1 patients are going to have a normal lifespan. They are going to have a happy, healthy future. Believe in science, never experiment with your disease. Thank you very much. And until next month, bye-bye from the JDC Diabetes Gems team from Jyotidesh Diabetes Centers, Kerala. Bye-bye.